Let us pray. Almighty God, we bow down before Thee in humble obedience and dependence. We pray Thee, grant us the grace to respect each other this day in all our consultations, that our deliberations today shall take place in the spirit of mutual trust, so that we as leaders shall lead our country on the path of peace and shall find solutions for issues and problems facing us. Grant us the mercy, O Lord, that we shall today also honor Thy name in all we think, do, and say. Almighty God, we pray Thee, bless our land and all its people. This all we pray in the name of Jesus Christ, our Lord. Amen. Let's affirm, I solemnly affirm, that I will be faithful to the Republic of Namibia and its people, and I solemnly promise to uphold and defend the Constitution and laws of the Republic of Namibia to the best of my ability. Please be seated. The House is called to order. Any report of standing committee or select committees? Other reports and papers? Notices of questions? Notices of motions. I recognize Honorable Maharuka.
Honorable Deputy Speaker, I do not know whether the Deputy Minister of Safety and Security is here or not.
Are you on the questions?
Yes. The point that I want to drive home is, I think it's about a fortnight ago, I've asked him an oral question that he promised to go and do some research. He would come back based on urgency. And still I have no answer. I don't know whether he's around. If he's around, good. If not, maybe then I'll ask him tomorrow.
Both are not here. I repeat again, any notices of questions? Then we go to notice of motions. Notices of motions, none. Message from the head of state. Ministerial statement. Then we go direct into the business of the day today. We have got motions, and the first of notice of motion is one of Honorable Minister of Justice. Is he here? I recognize Honorable Opindi.
Honorable Deputy Speaker, the Minister of Justice has requested that item 1 to 4 be rolled over to the 16th of March.
Yeah, repeat again.
Honorable Deputy Speaker, the Honorable Minister of Justice has requested me to request the House to roll over all her items of the 4 motions to the 16th of March, next week, Wednesday.
16th of March.
Yes.
Thank you.
Thank you very much.
So it means notice of motion number 1, number 2, number 3, number 4 is deferred to next week, Tuesday? Yeah? Wednesday. Okay. The next one then is Yeah, the fifth notice of motion is the one by Honorable Venani. Does Honorable Venani move the motion? Who seconded the motion? Any objection? You have the floor. You have the floor to motivate your motion.
Honorable Deputy Speaker, honorable members, I once more rise to move another landmark motion. Very landmark. That envisaged to address one of the foremost important issues in our country's socio-economic strata, and that is to move a motion that seeks to articulate a position of universal health care coverage for all the citizenry of our Republic, Namibia. Honorable Speaker, what can a country, John F. Kennedy, paraphrasing John F. Kennedy, President of the United States, who once said, "Don't ask what America can do for you, ask what you can do for America," quote unquote. I want to paraphrase him saying that what can a state, what can a government, what can a state, and when I speak of a state, I'm speaking of an institution that is permanent, not the winner of the tender of running the state. Talking about the state as an institution. What can the state bequeath to its citizens better than healthcare? Now in Namibia, we have a dire situation before I venture into my statement. The dire situation is the fact that today, if you go to the big room, many of you do not know what is the big room. Karutura State Hospital. There is a place called the big room. I made 4 surprise visits in the last 2 months at the big room. And you watch how doctors, how our health personnel are really trying their very, very best to give service to our people, and how the system is collapsing under their noses because our health infrastructure is collapsing. As we are speaking for the last 3 months, if you are a high blood pressure sufferer, the diabetic, you don't find medicines available in our own laboratory, in our own pharmacy here at Karutura State Hospital. Now, what can we do as a country to address the conundrum of a universal health care? The population of this country, only 18% of us seated here qualify for what is called a medical aid. 82% of the whole country's population must depend on public health system that do not cover for services that a lot of people do need. Now, there was a scenario in the healthcare system where when you are looking for an ICU bed, if you are older than myself, and you are the age of Utoni Nuyoma, for example, someone his age would be told that we will not avail a bed to you, an ICU bed to you, because you are too old. Meaning that it's okay for you to die, but we can only avail that bed to somebody who has a longer life period, who is 18 or 23. How can you have a health system that says it's okay for you to die because you don't have facilities? That is the scenario that we are talking about. Now, Honorable Speaker, health is very paramount. Health, spera. Honorable members, Honorable Speaker, the 5th Prime Minister of Barbados, Owen Arthur, and whose economic policies significantly cut unemployment in his country, once said, and I quote, "For he who has health has hope, and he who has hope has everything," quote unquote. Only 18% of the Namibian population has a regular access to private health services. The majority of the population, which is 82%, is dependent on a public health system or out-of-pocket OOP expenditure in the private sector. Universal health care means there is a healthcare system that provides coverage to at least 90% of its citizens. This is desperately needed, especially at a time when families are suffering with a massive increase in poverty that even precedes the COVID-19 pandemic. According to the 2021 World Bank report, 1.6 million Namibians are living below the poverty line. This leaves no money to take care of their health and leaves them at risk and vulnerable to unforeseen medical expenses. This House must urgently debate how best to take care of our people. Health care cannot only be for the rich and the privileged. It must be extended to all. We all know the state of the hospitals in our country. There was a report drafted by the then Minister of Health, Dr. Richard Chapi Kamu, which exposed how public health continued to falter and threat ordinary Namibians as a second-class citizens or orphans in their own republic. It is not an indictment on doctors and nurses in public hospitals who continue to do their very best and so many funding and other challenges. What I'm saying is that all Namibians must have access to the very best medical treatments, including at private medical institutions. Honorable members, the Namibian private sector is sizable, with 844 private health facilities, 72% of the doctors and little less than 50% of registered nurses. There has been a dramatic increase in access to healthcare in Namibia, but this is skewed towards the private sector, where poor Namibians, because of a lack of a universal healthcare coverage, do not have access. For instance, 76% of the population live within a 10-kilometer radius of health facilities. On average, in rural areas, there are about 5,780 people per clinic and 58,825 people per district hospital, 60,000 people per district hospital. Hospitals, however, suffer from overcrowding and long wait times as a large number of people bypass clinics and health centers closer to home and go directly to hospitals that are perceived to offer a high quality of care. The goal of having a universal health care coverage is to ensure all persons within the system to obtain the health services they need without suffering the financial hardships when paying for services provided. A key principle in this regard is service according to needs and payment according to means. Having a universal health care coverage will foster people's equitable access to health services while preventing them from being pushed into poverty when having to pay for such services. Having it will also ease the burden on our state facilities by giving poor Namibians a guarantee that they can be treated at a facility of their choice, be it public or private. Or are we saying that expert healthcare isn't for the elites in this country, or even worse, that the rich should continue to exercise their options of taking their ailments overseas, while the rest of ordinary Namibians are left with broken public system which the government has struggled to fix for years. Honourable members, internationally, countries such as Australia, Barbados, UK and many others have successfully implemented the universal healthcare coverages. Thailand, with a per capita health expenditure almost half that of Namibia, $385 compared to Namibia's $619, reached a universal health care in 2010, with a great deal of popular support. The Thai government passed the National Health Security Act in 2002, which established the universal coverage scheme, combining the already existing medical welfare scheme and voluntary health card scheme to expand coverage to an additional 18 million people. In total, Thailand has expanded coverage to 65 million people, or roughly 98% of their country's population. In Africa, Rwanda, for instance, a country with a per capita income of nearly $644 as opposed to Namibia's skewed one of 4,328 per capita, has achieved near universal coverage within 8 years using a modified version of social health insurance. 3 years ago, the Kenyan government, Africa again, piloted a universal health coverage program in 4 of its 47 areas, easing access to health services for millions of its people. It has since added more than 200 community health units, with over 7,700 community health volunteers and over 700 health workers have been recruited. The Kenyan government started scaling up universal health coverage based on the experiences from the pilot phase, and has focused on further reforming its national hospital insurance fund, establishing a mandatory universal healthcare coverage scheme, adopting an essential package of health services, and providing health coverage for an initial 1 million low-income households to be biometrically registered. It is thus a critical component of sustainable development and poverty reduction, and a key element of any effort to reduce social inequities. It is thus the hallmark of a government's commitment to improve the well-being of its citizens. Honourable members, we should bear in mind that this universal healthcare coverage is a goal that will show the Namibian nation that we as lawmakers are serious about caring for our citizens. Having it will ease the burden and cost of keeping Namibian families healthy as we continue to face both internal and external factors. 32 years after independence, we don't have our own dialysis center in our own country. We are dependent on private dialysis center. If you have a heart problem, a good friend of mine, now a new member of the ruling party, Phil Yanangolo Shimbungu Shatape, must undergo a heart surgery. And I'm speaking about it with good authority. He must undergo a heart surgery. I underwent a heart surgery. Open death, the worst human surgery ever. He can't go a heart surgery because the doctor that is supposed to operate on him is on leave. So his life is put there on leave. And this is the situation in our country. And I can talk about a number of cases of people that need medical attention in this country. You are told, we can do nothing about you, Mr. Ukap, just go home until we sort out the problem. This is the seriousness of the health problem. Now I want to use an analogy famously used by a former member of this house, quite a very erudite member of that side of the house, Tate Kangurohi Helmut Angola. He used to tell a story many years back when he was seated somewhere there that there was a minister of prisons affairs in Uganda many years ago. I don't know whether it was in a regime of Mbuti or Idi Amin, but it doesn't matter. But so did the story goes, that this minister was given money to improve the welfare of prisons in his country. But he took every bit of any contract, he took it to himself for himself. Until one day that he was caught and he went to prison. Now when he went to prison, people were not being rationed sugar. So he was asking fellow prisoners that, oh, you mean we only drink tea without sugar? And one gentleman replied to him and said, my brother, when you were supposed to buy sugar for prisons, you were stealing the money for yourself. When you were supposed to improve the welfare of the prison system, you were stealing the money for yourself, and now you are asking us whether there is sugar in prison or not. Now this analogy indicts any person who sits in a position of power, and I do not exclude myself from this group. We are the lawmakers of this country. One day, we will not be in this position of privilege. Our families are not in this position of privilege. One day, Namibians will come and indict us and ask us, Ambuka, Kapopi, Venani, Shaningwa, Kamekotora, were you not lawmakers in this country that were supposed to fix our healthcare? And now you are complaining that your limb is broken and the doctors must come on time. So it is time for us as leaders of this country, across political divide, to move barriers that are holding our people behind. And one of those barriers, and our country is given a very small population, we can do something about universal healthcare. Even if we start piloting 4 regions, you pilot Kavango East, Oshana, Komas, and Omaheke as first pilot regions to start implementing universal healthcare, you would see the difference that could happen to the health of our people. We should bear in mind that this universal health coverage is a goal that we show that we have a commitment. We should be compelled both by our conscience and good socio-economic sense to move towards establishing a national healthcare financing scheme. A 2021 report of the World Health Organization on the health financing policy explains that various financing models are used to achieve universal healthcare coverages. Some countries follow a Bismarck-type social health insurance, in which health expenditure is financed through member contributions, while others use the Beveridge-type national health insurance, the SHI and NHI, a tax-based health financing system. Through the Bismarck system, this is achieved by compulsory funding both employers and employees administered by pre-existing sickness funds. Similar laws have been carried out in Japan since 1922 and elsewhere in Europe. While the Beveridge universal healthcare coverage is funded from general government revenues, coverage for the entire population, this funding is similar to that of the Russian Federation system currently. Given such experiences and scenarios, despite our income levels, Namibia can take concrete steps related to the objectives of the universal healthcare coverage goal, given the size of our population, which currently stands at roughly 2.6 million. Furthermore, the World Health Organization data shows that countries at all income levels can, and with some, have recently made important progress towards that goal. Article 95 of our country's constitution covers the active promotion of welfare of the population, such as rights of the citizens to have access to public facilities and services in accordance with the law. Furthermore, the state is responsible for the consistent planning to raise and maintain an acceptable level of nutrition and standard of living of the Namibian people and to improve public health. Namibia is one of the countries with the most innovative social security approaches, structures and models. I'm giving credit where it is due. The government established the Social Security Commission in early 1995 with tasks that include publicizing and administering funds and implementing the reforms, among others. Further, the Social Security Commission Act is mandated to establish a national medical benefit fund, a type that is aimed at providing payment of medical benefits to employees. As such, the National Medical Benefit Fund can serve as a subset to a broader national health care coverage and paved the way for universal healthcare coverage. But while the Commission provides all different kinds of social protection such as maternity leave, sick leave and death benefits, funeral and survivors benefit, ensuring adequate health workforce, improving skills, health facilities, financing as well as subsidizing medical costs for low-income households, and part funding health insurance schemes are critical and should be done in sustaining universal health coverage. Apart from the model other countries are making use of, establishing the National Medical Benefit Fund as mandated in the Social Security Commission Act is one of the options Namibia could look at. Honorable members, Honorable Deputy Speaker, 10 years ago, around 2011, the Social Security Commission commissioned a strategic study on the design and implementation that is well. 10 years ago, around 2011, pardon me, the Social Security Commission commissioned a strategic study on the design and implementation of the National Medical Benefit Fund, which was completed a year later. Stakeholders' input was solicited, but was never shared with this House. As a country, we cannot give up the goal to have a universal healthcare coverage in our lifetime. In fact, the Ministry of Health and Social Services should report to this House on this matter about the efforts it has made when it spearheaded the study towards establishing a universal health coverage in the country. We have made some improvements in our health system over the years. This is considering that we have a large, dispersed and complex health system made up of around 1,150 outreach points, 265 clinics, 44 health centers, 30 district hospitals, 3 intermediate hospitals and a national referral hospital, Windhoek Central Hospital as well as some social service points. But much still needs to be done. We must overcome the obstacles to continue improving our healthcare system. Apart from what I've mentioned above, we are also faced with other obstacles, including a shortage of doctors, inadequate funding of income inequality. We face HIV/AIDS and tuberculosis crisis. As of 2020, we have the 6th highest HIV prevalence rate in the world, which is a serious concern. Honorable Deputy Speaker, honorable members, the WHO Afro region classified us as an upper middle income country, but Namibia presents the lowest health outcomes. When African Union members met in Abuja, Nigeria in April 2001, they committed to allocating 15% of their government budgets to health. This is because more resources were required to address the pressing health challenges of the day, including the HIV and AIDS, malaria and tuberculosis, to mention but a few. Close to 20 years later, our total health expenditure is still at 6% of the real GDP. This is below the Abuja target and even lower than the 5% of GDP of the sub-Saharan African average. Of course, achieving improved health is a costly endeavor, but many African countries, including that of ours, with limited fiscal space can still do it if we move on from spending targets to asking what level of resourcing achieves improvements in population health and universal health coverage. Are the funds being used optimally to advance a population health? And are there opportunities to improve efficiency and reduce leakages? These are the fundamental questions that we must ask ourselves. We should advocate for an adequate resourcing with strong and clear arguments to invest in health as a productive sector that builds human capital, reduces poverty and inequity, safeguards health security from pandemics, improves workforce productivity, and provides employment. We should also reduce spending on ineffective or inequitable public programs, such as fuel subsidies that disproportionately benefit the well-off, can be repurposed to increase government revenue and possibly increase allocations for health and social sectors. Strategies to make better use of existing resources include improving the timelines and flow of health resources, reducing health budget underspending, incentivizing health workers' productivity and efficiency, and proactively managing the procurement of medical commodities and supply. And I want to lament this issue. You see, in Namibia, the very reason why we have pharmaceutical products of low quality is because we are using a procurement system. We use a tender. We are looking for medicines to address high blood pressure. The tenderpreneurs goes to India, they go to Australia, they go to all these big pharmaceuticals, and they look for the cheapest medicine because they want to make buck out of it. And they buy these things, make a tender, sell to government. Most of the time, many countries that are practicing universal health coverage, they buy their products themselves to make sure that Namibians get the best medicine, or their citizens get the best medicine and value for money. Strategies to make better use of existing resources include the timelines and the health resources, reducing health budget and incentivizing. Health, honorable members, health is wealth. If Namibians can pay for life covers for as little as $600 per month, why can they not be given the same option, opportunity, and a chance to do so with their health? All these insurance companies run to you and say, if you are dying, the day that you die, Honorable Kapofi, you are going to get $3 million, pay me $300 a month. Then we do this thing. You are investing in your own death, but we are not giving opportunity to our people to invest in their own health. Going forward, we must consider having the Public Service Medical Aid Scheme, CMAS, become part of a national health financing arrangement, such as the NMBF. This would be an important step in ensuring the necessary critical mass to make such an arrangement financially viable. If you look at the money that 18% of the Namibian workforce spend on CMAS, we spend close to 3 billion, just to service a staff complement of 100,000. 3 billion to service all of us that are seated here in the civil servants. But we spend the same, we spend lesser. We spend lesser than 2.5 billion to service the whole 80% that needs to live from the public sector. And that is an anomaly and a paradox of that needs to be addressed. That fewer people are serviced by more money and more people are serviced by lesser money. How do you expect to have a health system that one can be proud of? Statistics obtained from the Namibian Association of Medical Aid Funds shows that CMAS only covers 10% of the population, civil servants, and this is with the allocation. We cannot afford, don't worry about time, the man that is speaking, there's no time limit. We cannot afford to have a situation where a poor mother from the informal settlements with a sickly son who is suffering from tumor to be turned away by a private hospital because of the lack of funds to pay for such an operation to keep their son alive. Let us improve our infrastructure, investment, do budget alterations and personal training in healthcare. Let us combine healthcare data with other parameters related to transport and housing. As we rebuild from the COVID-19 pandemic, it becomes important to create and monitor certain thresholds for public health infrastructure based on population. For example, regardless of whether an area is classified as rural or urban, if it has a certain population level, it would benefit from having a hospital rather than a single clinic, as an example. Establishing such benchmark in terms of physical infrastructure, specialization of personnel, relevant support staff, and reworking them as necessary can go a long way in building a population with a healthy life expectancy in Namibia, where low state capacity falls short of the demands of secondary or tertiary care. Further, given the burden on urban healthcare system, budgets need to be expanded to improve healthcare infrastructure, supply aligned with the disease progressions in cities. This must result from greater decentralization of finances and responsibilities as well as revenue from health tourism. Moreover, along with an increase in the health budget, There needs to be capacity to manage that spending. With the increasing use of technology and healthcare analytics to treat diseases, healthcare professionals will have to acquire skills to harness data and interpret it to provide decision-making support to medical practitioners. And I'm saying it, underlining it, that my proposition is not exhaustive and are not sufficient to tackle all the challenges we face in our health system. However, with adequate planning, we can guarantee a more robust system to deal with our problems and build a more healthy population and a productive economy. Honorable Deputy Speaker, it is therefore incumbent upon us as lawmakers to advocate relentlessly for an equitable provision of quality health care for all Namibians. It is possible, it can be achieved to ensure that all Namibians, irrespective of their income level, lead socially and economically productive lives. Honorable Deputy Speaker, with these few remarks, we do not only talk about a good health care, but also as a shadow government, we are leading by example, that we have provided a clinic to the community of Bruno in helping with the healthcare challenges, and we are going to provide more clinics to the regions as we are visiting them in order to help and to finance a proper healthcare for our people. Namibia deserves better, and all our citizens are looking upon us to come up with ideas and proposals that will move our country towards a universal healthcare coverage. Okunene, okuhepa, ayo, thank you.
Any discussion? I recognize Honorable Dinda.
Honorable Deputy Speaker, if there is nobody else, can I, on behalf of Honorable Winnie Mungu, adjourn the debate until next week, Wednesday? Thank you.
So the debate, or is there any? Yeah, I recognize Honorable Attorney.
Thank you very much, Comrade Deputy Speaker. I listened attentively to Honorable Venani, but I think he is a little bit late with his motivation, because the government of the Republic of Namibia has already embarked upon this exercise very robustly and very determined, and as we are speaking now, Cabinet has already received the report from the Ministry of Health, and we are moving on. So you can be rest assured you will not be indicted by anybody. No future generations will come. The national health coverage is coming, and it is on the way. So rest be assured. You can debate, but the government has taken a strong stance against it. Thank you very much.
Any further discussion? None. The debate is postponed to next week, Wednesday. Yeah, let's move to the sixth motion, the one by Honorable Deputy Minister of Health and Social Services. Is she here? Is she here? She's up in the gallery. Deputy Minister of Health and Social Services, are you there? Okay. Does Honorable Deputy Minister move the motion?
My motion, yeah.
Who second?
Please bear with me. I just entered the house, man. This is my motion. Which one is it? The old people. Yeah, I'm ready. Just bear with me. I need to take my...
Okay, who seconded the motion? Any objection? Honorable Deputy Minister, you have the floor.
No, I'm coming there. I just want to open my document. There is. I'm ready for the motion. Yeah. I just came in, I was doing other national duties, so there's no postponement. I'm ready. Thank you very much, Honorable Speaker. Deputy Speaker, thank you, honorable members, for your patience. I take the floor on a very emotional topic, close to my heart, since I'm just few months away from becoming an elderly as well. So this motion is on financial abuse or exploitation of older persons. Namibia is one of the few countries in Africa that pays out social grants to various categories, and I would like to commend the government of the Republic of Namibia in this regard. I think the other two countries are Botswana and South Africa. My focus is more on Namibia's old age social pension, not forgetting that financial abuse might not be limited to old age pensions, but also other social grants, such as foster care or disability grant. This old age pension or social grant guarantees all Namibians over 60 years of age, men and women, a monthly unconditional allowance of plus minus 1,300 Namibian dollars per month. The universal social pension, combined with social services, can be an effective instrument to lift older people out of extreme poverty, to strengthen their dignity, as well as to stimulate local economies. The provision of regular and adequate pension benefits not only the older persons, but also other members of the extended family, especially grandchildren. Importantly, these pensions address the plight of the poor old persons, giving them a sense of dignity and full sense of citizenship. Honorable Deputy Speaker, according to data available, and especially for those who only receive pension money in cash at various pay points, the amount per month is 126,000 Namibian dollars, which means that per year the GRN spends 1,512,000 on old age pension only. Mind you that there are other grants. This number and figure is not true reflection, as it doesn't include those elder persons who receive their money through the banks or name post. By the time I was drafting my motion, I could unfortunately not obtain the correct number of elder persons registered with the Ministry of Gender Equality, Poverty Eradication, and Social Welfare. So the number of elder persons who receive old age pensions is higher than what I can mention in this house. And the amount of money spent per month could be more than the 126,000. But what is clear, Honorable Speaker, honorable members, is that the government of the Republic of Namibia spends millions per year on social grants. This is a lot of money, and hence, we cannot fold our hands. There is a general attitude that outsiders should not interfere in the financial affairs of another person, especially the elderly. But I believe, and that is my conviction, that as parliamentarians, as lawmakers, we have an obligation to find ways on how older persons can be protected against financial abuse and exploitation. Honorable Deputy Speaker, what is worrisome is the numerous reports or incidents of pensioner abuse by family members and in most cases own children. Pensioners are being threatened and abused over their grants. In some instances, some are even assaulted physically and or are threatened with death if they don't hand over their monthly payouts to younger relatives whom they are taking care of. There are also cases where the older persons themselves abuse the money, using these grants for alcohol and gambling, causing them to stay without the basic needs. The motion I'm tabling in this August House is about elder abuse in domestic settings, that is within the older person's own home and in the home of a caregiver, and not necessarily referring to the older persons living within institutional settings. Unfortunately, the vulnerability of older persons is being abused not by family members only, but informal vendors and criminals who take advantage of the elderly. On the day of payment, of payout, vendors are gathered at these points and they force older persons to buy from them or to take and pay with the next payment. It is so heartening that some elder persons have to pay 600 that they allegedly owe for home brew or tombo. Tombo that costs $10 maybe per cup. But on that day, they are the targets of people with criminal minds. Mind you, Honorable Speaker, Deputy Speaker, that the older person comes to receive his or her money, and 600 is already gone, remaining with 700 that he or he is taking home. Honorable Deputy Speaker, honorable members, elder abuse, at least to some degree, has probably always existed. Only in the past few decades, however, has it been recognized as a major societal problem. According to Dyson and Heisler 2000, as well as Moskowitz 1998, elder abuse is today widely characterized as both a universal problem and a growing concern. Research on financial abuse of the elderly in Namibia is limited, but occasional reports in the financial exploitation of the elderly do occur. And I want to refer to qualitative studies that were done by Klee and Ananias, as well as Ananias. The Klee and Ananias 2021 reveal that pension money of pensioners is either stolen or taken by force or used without the consent of the older person by family members, caretakers, or in some cases non-related people in the community. Both authors further postulate that especially on paydays, pensioners may become victims of robbery either by strangers or even trusted people accompanying them to the cash pay points. And I want to quote them saying that some family members would force the elderly to give them the pension money. Youth are waiting for the elderly to rob them at the cash pay points. Grandchildren had unauthorized access to the monies of the grandparents, and sometimes all the money was withdrawn from the ATM. Where elders cannot read or write, they are forced to sign false documents that can even lead to the grabbing of their funds and other valuable properties. In some instances, grandchildren are sometimes left in the care of grandparents, while the biological parents make no financial contributions for the caretaking. In that case, the grandparents are left with no choice but to use their small pension to provide for the needs of their grandchildren. Honorable Deputy Speaker, honorable members, Ananias 2014 persists in her findings that the key informants report that caregivers misuse the old age pensions for their own personal benefits, with the needs of the pensioner being ignored. Respondents also reported that caregivers were around only for as long as there was some pension money, but they disappear the moment the pension has been depleted. One key informant, for example, said, and I quote, "Children are only interested in a pension on the first week of pension payday. It is okay. And from the second week, the elderly are again on their own." So those are testimonies that people are just interested in a pension money. Older people reported that their pension money was being stolen and that they were being robbed by their own children as well as other youngsters in the community. Now, this one is very important. Pensioners receiving cash pension payouts were more at risk than those pensioners who receive their pension payment through the bank or post office. That's important, and I want the Honorable Orkes House to take note of that, because in my recommendation, that is something that I will touch on. Respondents reported that other old people would hand over their pension money out of fear for their lives. Another caregiver, for example, disclosed that her brother, who is also a pensioner, has been a victim of financial abuse. The caregiver said this, and I quote, "To tell you straight, my brother also has that abuse of money. He is telling me I will die, not because of illness, but my child will kill me, because he must give that money. Now he, the abusive child, has become used to it. If he, and that is the abusive child, is not given money, then it is a problem. So the dad or the father must give money to have peace at home." So these are paintings to see how our old senior citizens are suffering at the hands of their own relatives. Honorable Deputy Speaker, honorable members, from a psychological point of view, a loss of trust in others has been identified as the most common consequence of financial abuse. Now, to this regard, Philo 1987 indicates that older persons may become very fearful both of crime and their vulnerability to crime, which in turn may lead to dramatic changes in lifestyle and emotional well-being. Elder persons who are exposed to financial abuse or exploitation may lose trust in their family members or children and start isolating themselves from friends or family. Financial abuse may lead to depression, hopelessness, or even suicide. Honorable Speaker, in conclusion, Namibia ratified national instruments on aging, such as the Madrid International Plan of Action on Aging, MIPA, and the African Union Policy Framework and Plan of Action on Aging. The question is, do we as a country have adequate laws to address financial abuse of older persons? The answer is, there is inadequate national legal provision for older people in Namibia. The Aged Persons Act of number 81 of 1967 is very, very outdated. 1967, I was like 5 years old. There is no national policy for older persons. So, based on that, Honorable Deputy Speaker, I'm doing the following recommendations. Although the GRN has made an effort in providing these grants, our older persons are still living in poverty and many hardly survive. Therefore, I propose or recommend the following. We need to have proper reporting and treatment systems in place to effectively address the problem of financial abuse of older persons. Two, I am very much tempted, Honorable Deputy Speaker, for this August House to think about introducing a card system that can be uploaded instead of paying cash. I was struggling with that because I'm also taking into account that if that is the case, we introduce that, arrangements can be made for the older persons to use that card to buy food only. But I'm also cognizant of the fact that those facilities might not be available in all corners of our country. But the good thing of this card system is also the fact that older persons will not have cash at hand that will make them more vulnerable and exposing them more to criminals. But that is something for the House to ponder on it. The second or the third recommendation is that there is a need for a national policy on older persons in Namibia and enactment of the law on the rights, care and protection of older persons in Namibia. I'm happy to mention that the Department of Social Welfare in the Ministry of Health and Social Services, they are currently busy with the research. And that research is needed because it will help us to develop a broader understanding on financial abuse of older persons in Namibia in order to define its parameters. And with that, with such a report, through focus group discussions, we will also be able to hear the perception of the older persons themselves on the alleged abuse and also take into account the cultural context in which this takes place. Because in some cultures, grandparents feel like they have an obligation to care for their grandchildren. Another recommendation which is very important is raising more awareness and education on the existence of financial abuse or exploitation of older persons. And the last one, rehabilitative services for the older persons who abuse their own grant. So, Honorable Deputy Speaker, that this motion be referred to a relevant parliamentary standing committee for further analysis and report back to this House. I so move, Honorable Deputy Speaker. I thank you very much.
Thank you. Any further discussions? Honorable Venani? If you want to take the floor, you can do it after tea, or if you want to postpone, it's also fine. Yes. Yeah, the House is adjourned
For tea.
Up to 2 minutes, 3 minutes past 3 minutes past 4. 3 minutes past 4. Yeah? House is called to order. Honorable Benani, you have the floor. The mic, the mic.
Yeah, what do you want to think? Thank you. Gracias. Honorable Deputy Speaker, I first and foremost want to thank Honorable Muinyangwe being a social scientist, somebody who has read the area very well, understanding the psychology of many of us. I just want to echo her sentiments that it is true. It is a truth that we don't want to talk about. That if you look at the amount of money that we are giving to old age pension and the flagrant abuse of those resources, it is a matter of serious concern. My experience is quite very different than hers, in a sense that I see a lot of business people. Old age pensions are keeping, especially the rural economy, alive. That is a fact. Most of those small businesses are kept by the old age pension. But this is what happens. Somebody takes the ID, identification document, the bank card of a pensioner. Pensioner, Venani, God forbid. I don't want to become a pensioner. But it is inevitable. You buy from the shop a beer. I don't know who's drinking beer here. No, I don't drink. I drink Omaire and
Yeah, please proceed.
Derek drink beer. What is the cost of a beer now? Beer bottle? 16? Maire is free of charge. $20 or $8 something, and I'm using it as an analogy. Then this person, of course, due to account of old age, does not know the prices. He is in need to buy commodities to keep him alive. He gets solo oil, he gets whatever he needs to. But then these shoppers are doubling the price, the cost. A butter that should have ordinarily cost $10, it is now costing $40. End of the month, the pensioner comes and says, okay, deduct what I owe you and give my change back. What happens is that there is no change. The pensioner loses everything. And then, on account of trying to keep this relationship alive, a parasitic relationship, I must say, you are told that no, Venani or Kapofi, you can still buy more for the next month. So this thing becomes perpetual to a point. We are coming from villages, we are coming from homes of elders. You come in and you ask, oh, uncle, why don't you have shoes? No, I owe the shop. Uncle, why don't you have a toothbrush? No, I owe the shop. Which shop do you owe? We go there. How can a pensioner, a thin man, eat food of 1,200? And this man has no food. So that abuse exists. To men, it's even worse. Because if you look at the expenditure that men does with their money, men pensioners, as opposed to women, at least the women folks would always buy food. Now men do not buy the food. They buy alcohol, they buy other things that I don't want to mention due to respect, and all those other things, and the economy of that money is gone. So it's a serious problem that needs to be addressed. And I'm very interested to know, I see the minister also wants to come in to talk about perhaps programs that she has in a ministry to make sure that people are protected. So most of the time, pensioners are robbed of their money. And those that are having disabilities are even worse off. They are even worse off because you would hear someone lives in a village, unemployed, young person. She has all the cards of all the pensioners in the village. I had a man who raised us. He was a builder of my father. And he grew up with my father, probably a little bit younger than my father, but he's somebody who raised us as a parent, co-parenting with. Now, he passed on some few years back. He came from Mafikeng many years back. So I used to ask him, Uncle Toe, wat maak jy met jou geld? Nee man, die winkel, die kaart is ook by die winkel. The card is at the shop. I said, Uncle Toy, I'm bringing shoes, I'm bringing this, but these things you can buy most here in Grootfontein. And even these people that are selling this new second-hand clothes, they have good clothes that you can buy. This man for 12 years has never spent from his own card. That card was just with someone in the village. Now, of course, those that are benefiting are enterprising because it's a loophole. But how we should protect these people is a serious reality that we need to protect. And I agree with you that perhaps a card system, because even the banking system, those that are receiving money through the banks, you have people that makes them their business to queue up for them. Let me go and withdraw for you in the NAMPost or somewhere. Then these people are queuing for 10 or 20 pensioners at NAMPost in Rundu or in Divundu or in Okashiro, wherever. And everyone that is withdrawing, a 400 is taken. 400 is taken. Our elders, they raised us, many of them don't even count. When they see the $100, the 100 red boy, they think, my son is good. So it's a serious problem, and I'm very glad that a person of her training and a person of her caliber being a deputy minister has brought this issue. That it is a reality that we need to address. And it's a serious matter that a lot of our pensioners ought to have a better life. But if you go to villages, and I'm not saying it because of who I am, I'm saying it because it's the reality. Just go into your village. When you start entering the village, to pay $20, give me a $10. Give me, you know, when you go to the village, you have to count your money in such a way that you have a lot of $10 to start giving to people. Not that the people do not have their own money, but people are being exploited. They are looking for the little dollar from you, and they are earners of something, and they make as if they don't have anything. So I think we need to do a bit of research best practices globally, and to see how we protect our elderly. Because the men folks are really, really suffering. The majority, the women, they generally women know how to take care of themselves. It's a natural thing. Even our own wives, do you know what? You would always ask Lodina, where are my socks? Someone who lives in you live in the same house, but you ask her, where is that shirt of mine? Because the women have a tendency of taking care of themselves. We don't take care of ourselves. That's why after years of marriage, 17 years, your wife would tell you that, you don't even have a blanket in this house. All of us here, even if I ask that, who's married, if I ask him, do you have a blanket? He doesn't have one. He's just given a blanket. So it's true. Do you have a blanket? I doubt whether he has one. So all I'm trying to say is that yes, it's a gray area that needs to be fixed, and we have a lot of experiences that we are reliving here. I even doubt whether the Carl Schledvan has a blanket. I doubt of his own. But these are the realities of the situation. So I really support, and I think we could do more to research the area and try to help our pensioners. Thank you very much, Honorable Munyangwe, for bringing the motion.
Thank you. I recognize Honorable Doreen, Minister Doreen Sioka. You have the floor.
Comrade Speaker,
because I'm seeing some people are still indicating. For me, it was to adjourn for tomorrow. Just tomorrow, I'll
Okay.
come in. But I'm seeing some people
Okay,
indicating maybe.
Honorable
they-
Minister Slotway. Yes, you have the floor.
Thank you, Honourable Deputy Speaker. To start off with, I do agree that it is important to create social networks, to improve them over time, and these social safety networks, of course, should have as the main aim to protect the more vulnerable of society. So that notion is absolutely correct, and I think we all agree on that. I want to recall that when President Hage Geingob became president, it was he who made his mission to improve the social networks, especially for the elderly, and we managed, despite economic difficulties, to increase the social grant scheme from 650 per month to now 1,300. Now that increase in cash contributions to elderly had and was the single most important factor to decrease severe poverty from 17% when we started to now around about 10%, just below 10%. So it worked. And I'm saying it not to deny the validity of the quest to improve the beneficiaries' take home from this pension. But if it does reduce severe poverty, that tells me that misuse of the pension is not that severe, because the target group, those that are severely poor, moved out of severe poverty, many of them. So I think we have to be maybe more accurate in our data before we assume and make arguments that social grant monies are grossly misused, they are stolen, they are taken by the youth. It cannot be. The statistics don't support that. There are some cases, yes, but it is not a general case. The next argument I want to make is
Point of order.
if we say that.
Honorable Minister, point of order from the side.
Yes, thank you, Honorable Minister of Land Reform. I am following your reasoning and the analysis that you are putting forth. I just want to moot a question with you and to ask a question for clarity. Sure. And then, should your answer be in the affirmative, moot a proposal with you. And maybe you can say whether that perhaps negates what you are saying or not, depending on how you analyze it. Firstly, when you are talking about the statistics of reduction of poverty, are you referring to this specific bracket of pensioners, or are you talking about poverty broadly? Yes, poverty broadly. In the event that it's in the affirmative, that you are talking about the broader poverty indication or index, take a scenario where a mother lives in poverty at 60 years old or 70 years old. A son at 45 years old lives in poverty. The grandson at 20 years old lives also in poverty. This is the same individuals. Now the 45-year-old son takes this money from the mother in an abusive manner. Now, through that, supports himself. And therefore, when a survey comes, it indicates that perhaps he has more food on his table in one way or another, and thus that has a result or an impact on, in my considered view, on the outcome of the survey, the poverty survey. But the person to whom the money is destined, who is abused and deprived of this money, still remains in poverty. Is that, by that really I want to say, does that then not negate the argument that says poverty has gone down because of this grant, and therefore there might not, the abuse might not be as rampant as suggested? In other words, what I'm saying is, if the money is still in these poverty-stricken people, but not necessarily benefiting the one that is destined to, does that not negate that argument?
Yes?
Thank you, Government Deputy Speaker. Thank you for the question. Well, as I said, the argument is that the old age pension increase had the single most important impact on severe poverty. And the target group were old people, older than 60. Now, a census is a individualized exercise. You go to individuals and ask, what is your income, what is your income, what is your income? And the census came out that, yes, broadly, not per age, but the severe poverty bracket reduced from 17 to 10%. My argument is that either we were wrong in our targets, not finding the most vulnerable, most poor people, or we did. And the answer is we did, because the statistic changed significantly. So it must have been, by and large, elderly people that had no income, were severely poverty, that benefited. How they shared it had, of course, a ripple effect, and that is what Honorable Divanani has said. The whole economy in rural areas benefited from this pension, and it is not only old age people that benefit, but the whole economy was lifted, and there was more cash in the pockets of many. So your argument has some relevance, but I think it does not negate the statistical fact that poverty, severe poverty. What we also found when we went into the regions, during our rallies, during our information campaigning, it was the old people themselves that came to us and said, thank you for the money. And they still do it up to today. So they would not do that if it was stolen from them. Well, but I still make the argument that, yes, there are some cases where it is taken away and abused. But I think it is not a general problem. And I'm saying it because I also believe that Namibian people are not generally bad people that don't look after their old age, after the elderly. I don't think so. If I look in our society, if I look in rural societies, I have the distinct feeling that elderly people are respected, they are looked after as good as families and communities can. I hope I'm not wrong. I hope I'm not in a country, I hope I'm not in a country where one can generally say we neglect the elderly, we throw away our parents. I don't think so.
Yeah, point of order.
I severely hope that that is not the case.
Yes. Another point of order.
On a point of information, Honorable Minister, do you know how the psyche of blacks or black grandparents works? Black people like me. I'm black, right? Do you know how the old people psyche?
It's also black. Tell me.
The reason why I'm asking this question directly to you is that, Honorable Minister,
just listen. Let's
listen. Those of us that have grown up with grandparents, some of them are alive till today, thank God for they are around 80, 90 around. a grandparent from a black community will never, ever come out in a survey or wherever and say, I'm being robbed by my own kids. Never. It doesn't matter whether that grandparent is a Herero, it's a Nama, is a Noshiwambo speaking. From the experience that we had with grandparents, they will never expose their own kids, even if their own kids are treating them bad. And that's a reality. So when the Honorable Minister say, in your survey, parents and grandparents were saying thank you for the money, of course they will say thank you for the money. Yes, but they will never tell you the truth of what they are going through in their own household. Let's get that correct.
Yes, Honorable Minister.
Yeah, well, you know, Honourable Deputy Speaker, you know, it's a very interesting argument when you are confronted by saying that it is the culture of black people, old people, to lie if they are asked whether they get the money or not. That's what you are saying. So I have an issue with that.
Yeah, can I come in? Yeah, sorry.
He said that. He did.
Yeah, Honorable, yes.
Yes, Honorable Minister, you are totally out of order. The world in which you are living and where we are living is two different worlds. I will never ever say that they will lie. I'm saying it's the cultural upbringing where we are coming from.
The protective.
Very few parents, I'm telling you, you will have, I'm telling you, if some of you did not have parents, grandparents until today, I'm sorry. But for those of us that have lived with grandparents, that's a reality. And that does not say that they are lying. It's saying that they are protecting their own kids. Not that they are lying. Yes. Okay. If you say it's lies, but I will never tell it lies.
Oh, a point of order.
Well, I'm not disputing the reasons why they do that, but your words were they will never tell the truth. Yeah. That's what he said.
Are you...
But in any case,
Yeah, thank you very much, Honorable Deputy Speaker. In my motivation, I made reference to cultural context. And that is very important because for a black grandmother or father, they will think that they have an obligation to look after their grandchildren or even great-grandchildren without realizing that they are being exploited. That's why I said when we do whatever research, we need to hear them out also. And that is why I also said we need to have education for them to start realizing that they brought me up. They don't have a responsibility or obligation to still care for my great-grandchildren or my own grandchildren. That they don't, so they will not say that in any research. But of course when you do any qualitative research, you probe more. So that is where the education element is also coming in.
Okay, Honorable Minister, proceed. Which procedure?
Thank you, Honorable Deputy Speaker.
No, I just make exception. Honorable Doctor, Honorable, I just make that one exception because you are the mover. At the end of the day, you will be required to respond. Just one. Okay, proceed.
Well, thank you. I think we are derailing a little bit, but in short reaction, I do not know any community in this world where grandparents are not worried about the upbringing of their children and their grandchildren. So it's not a black or cultural thing, it's a very general human thing that all of us worry about the upbringing of our children and our grandchildren. So I want to leave it as that.
Okay.
Honourable Deputy Speaker, I just want to go one step further and say if we want to improve the lives of our elderly, I think the better approach would be a positive one. Not look at reasons to diminish the benefits of what is happening. And I think as government we are doing that. We have actually in principle approved to entertain a basic income grant, but at a not a general way, but a differentiated manner, that we have some kinds of means testing who benefits the most, so that we do not lose the target of the most vulnerable. And I think that is the better approach than to look at the negative side. It will, of course, need to be done. The administration of the grant, of any grant scheme has loopholes and has weaknesses. But if the weakness is a cultural-based one, a family-based one, the question must arise, how paternalistic must the state become? To what extent must we follow the money and dictate what you may do with the money or not? Do we want to go ahead and say a person over 60 that gets a grant may not buy a beer with that money? Or may not buy tobacco or cigarettes with that money? Are we saying that? I would be worried if we go that far. I think it is not proper to dictate to an respected elderly to say what he or she must use the money for. So, I believe we are doing not too badly, we are doing all right, but I agree that there is some abuse and that must be tackled. And I also agree with the mover that education is probably the best tool to bring about that set of values that we have to look after our elderly people in a proper way. One thing that you also said which touched me is you said that there is a saying that says if an elderly African passes on, it is that person is going with a lot of knowledge. And that's the prime reason why we respect our elders. That is true. But that also goes against, what one can perceive out of the motion, that is that there is cheating of elderly. I thought we live in a society where we really respect our elderly and we have to do whatever we can to protect them against bad practices and exploitative moves by other parts of the society. So I don't disagree with you, but I think my point is clear. I agree with you, and I hope we can agree that the positive things are what we have to follow. Thank you.
John, I recognize Honorable Ndina.
Thank you, Honorable Deputy Speaker. Honorable Deputy Speaker, I will start my contribution by acknowledging and appreciate that the SWAPO-led government did not, after independence, stop the social grants, but rather continue with it. Yes, thank you for even increasing it. We appreciate it. And let me say why I appreciate it. some of us are moving towards that age. Moving towards, not those ones who are already there and still sitting here and laughing at me. We are also moving towards it. So, and I want us really to discuss this issue so that we can come up with solutions for problems which will start facing us one of these days. Those ones who are already getting these pension grants, you must talk about your experience and tell us what is it that you are not happy with. Our parents did not have pension those days. So that's why I'm saying we appreciate it, so that they can also benefit it. But Honorable Deputy Speaker, let me start with where this problem starts. We are talking about children abusing their parents. Let's start with the pay points where our senior citizens are getting their monthly pay. There's no chairs, it's just under the sun. There is not even a roof for them. And this is where the abuse starts. That the people who are getting these tenders to distribute this money on a monthly basis are abusing our people right from the start there. So, Honorable Speaker, I will really appreciate it if the Minister of, I think it's Health, not Gender, who is responsible for giving out these tenders, to make sure that it must be a condition that we must treat our elderly with respect. Otherwise, can we move to a new system of numbers through the banks and so on? I know my grandparents don't believe in banks because you will receive a 1,300 in your bank account, but at the end of the day, there will only be 1,100 available. So they don't understand what happened to the 200 it went for banks, bank charges and so on. So people feel it is better to receive my money in my hand so that I can go cash and buy the things that I need. So maybe we must move from this thing of paying out cash there under the trees and on the stoop somewhere there to moving to a more formal system. That is something that I will really want us to look into. Honorable Deputy Speaker, I also agree with Honorable Venani regarding the cards of our pensioners being kept by debt collectors. It is either Shabins who are keeping these cards, or it is people for food and so on. That people never, our pensioners never saw the money. It is always, no, you come and buy on the book, that book never get finished. You will never, there's something left on the book. It will always be, no, you spend your whole money. So the person will continue with this book system of taking things on account and so on. So it is a problem. It is a problem, but our people don't know where to go if they need, if they are hungry. And then we are talking about children abusing our grandparents. Our children are unemployed. Our youth are unemployed. They are staying with these grandparents. It is the grandparents who are feeding now the children, or the parents feeding the children, because they don't have a work. So we really also have to, together with this abuse of our pensions money, look into the unemployment rate of our youth. It is part of our problems that we are causing. Our children are supposed to take care of their parents and their grandparents, but they cannot take care of them because they are unemployed. So there is this issue of abusing. We know about it. They are taking the money, and the money are being taken even there. Oh my goodness, can somebody just take the floor if you want to take it? So, Honorable Deputy Speaker, so we really have to look into the root cause of this problem. It started there at the pay collection center, where the money are being grabbed and everything. And then I want to go further. Our pensioners are losing their assets, houses. They are losing their houses. There are maybe 20 people in the house, living there in their house, and in that house is only income from the pensioner. So they are losing their houses because they can't afford paying even the basics like tax and rates with these pension payouts. So, Honorable Minister of Finance, you are not here, the deputy is not here.
She's there.
Oh, you are here, thank you, my sister. I have noticed, despite all this abuse and whatever of our senior citizens, we need to increase the pension on a yearly basis, annually. 1,300. Somebody told me a pensioner is not even enough for combo. Those of us who stays in Katatura knows what is combo. Those of you who are staying in academia, you don't know what is combos. Combo is a maize meal, cooking oil, sugar, just that basic. It's a combo. We call it a combo in Katatura. So they can't even afford the combo because the 1,300 is not enough. So can we at least cater? Yes, Tony Nyoma, you will never know what is a combo. You didn't go through that phase of a combo. Never. So you don't know what it is to stand in the shop
Yeah, proceed.
and then you, who shouts proceed?
Me, the presiding officer.
Presiding officer, give me also my chance.
I'm saying just proceed with your...
Okay,
Yeah.
okay, Honorable. So this is now a combo. Can you at least, Honorable Deputy Minister of Finance, look to cater for a combo? Oh, she doesn't know what is a combo. Oh my goodness. Honorable members, you must know what is combos. Your voters are buying combos. Honorable Speaker, let me continue. Honorable Deputy Speaker, there is also a new trend going on, that our senior citizens and our people living with disabilities, some of us are very clever in this world. So you will take the cut of that pensioner and you will go to Sanlam and Old Mutual and take out the life insurance for that pensioner. And you are paying that life insurance with his own, her or her pension money. You are paying it, but you are the beneficiary. Yes, I asked the question one day here. Honorable Kali was still the Minister of Finance, and Namfisha answered me a skewing answer. I could not believe it. I said Namfisha is part of this corrupt practices in this country. Because instead of investigating my question, they came up with nice answers, and I could see these people are not speaking the same language as us who are experiencing these things. You must investigate. If you don't know, investigate. So people are getting rich out of these senior citizens whom they know. This one, I'm so sick, they just look at your condition. You will not last long. Let me take out insurance for you. Then they will claim 50,000, 100,000, 300,000. This is also abuse. Now you are getting rich, that person died, and you continue taking out insurance policies for... No problem. Today I am Holy Mary, Mother of God.
I just want to ask.
Yes.
It's not coming.
Okay. Thank you, Honorable Deputy Speaker. I just wanted to ask my sister, first of all, maybe a point of order on the sense that she is referring to Namfisa as being corrupt for having answered her. Maybe we can ask the same question and we will answer her again. But the point I wanted to make is if maybe the Honorable Member can tell us which insurance gives a 70-year-old a 300,000 cover. I know about funeral covers that you can take. It has got a short term or the 6 months to qualify. They didn't mention any. But 300,000 because I want to go and take that policy. Thank you. Honorable Maureen, let me answer the first question that you say I must pose the question again. Do you think Namfisa, the one who must answer it, will have a different answer because it is you now? My dear, Namfisa is just Namfisa. I will repeat, they are just as corrupt as all other places. There will be no different answer. Even when I asked the question about this legal shield, corrupt legal shield, the answer that I got was not for my satisfactory, but I have to accept it because it's just Namfisha, that is how I know them. And your second question about the 300,000, I didn't say that. I say people are getting 50,000, 100,000, but there is, Honorable, you must just pay more. Your monthly contribution must just be more, so then you can take out the policy, but it's there. So it's there, and we are abusing systems to benefit us. So with this motion, I really want us to go deeper and further. I support this motion wholeheartedly because there are a lot of loopholes regarding our pensioners, our senior citizens, our people living with disabilities, and even our OVCs. These people are being abused from all sectors. It's not only the sector of children abusing them, but I do understand there are children who are in the houses not because they still want to be there, but simply because they are unemployed and they have nowhere to go. And no mother, even you are sitting here, no parent will kick out your child because he or she is unemployed. You will make sure the child will have a food, a plate at the end of the day, because this is your child and you will take care of it. So let's address also that issue of the people living, the conditions of the people who are living with these pensioners. What are their conditions? And then we will have our answer to this problem. I thank you and I support the motion.
Thank you. I recognize Honorable Minister Ipumbu. Okay, Honorable Minister Kapofi. Yeah, yes.
Yeah, thank you, Comrade Deputy Speaker. I rise to echo the sentiments of the mover of this motion. I think it has come at an opportune moment because what is being said here is not necessarily hearsays. There are a lot of truth in many of what is being said. We live among our people. My mother is fairly getting there now, but she will keep the money in the account, but there is no food in the house. Now, when you say, Mom, why do you have them? You have something. She will say, now, if I die, what happens?
I'm saving for you.
Now I say, you don't have to worry about me, you don't have to worry about your coffin. The government is in any case providing for it. Why do you want to worry about this? So now, no matter what amount of convincing you make, there is such a thing that what happens if I die? We say no. The idea is for you to buy your food. What happens when you die, that is the problem of those who remains. You say today, you say tomorrow is the same problem. Now, I'm talking about now that age that is still able to comprehend and to understand what you're saying. But at one point, an elderly person comes to a point where he or she is no longer able to make whether 1 + 1 is 2. They even sometimes forget who this person is. Now, they will never mind about money because they do not understand. Now, they are now at the mercy of those who are looking after them. It is really true to an extent that there are people who are suffering, especially those that are no longer able to fend for themselves. But that itself needs us to discuss, because really it is a problem. There was a talk about pay points. Whatever the condition there is, that's not my point. My point is, pay point has become, when it is a pay day or pension day, you'll see a heap of activities there. Hive of activities. People are storming there. What Honorable Venani had just said, I think he has seen it. It's really not propaganda. It's real. How we get out of that situation, I don't know. But perhaps the discussion and the debate and the activities, the findings that we may get will help us chart a new course. But it's important, even for the people who are looking after the elder people, must also understand and appreciate that somewhere in our assembly, in our parliament, people are discussing these things. There is a concern. It's a genuine concern that is there. There are people I have seen with my own experience where a brother has to remove the mother's card from the sister. To remove it, and there was a hatred between them, a complete one, because the sister was abusing the mother. So this card has to be given to a neighbor who must come and help the mother. These things happen. Of course, it's not everywhere. It's not universal that it is there countrywide, but it is acceptable. It's real. In real life, we have also other grants that we give to children, or this OVC, or how. See how that money is being used. So really, what we want with these benefits is not just to circulate money in the economy. It's not only just to circulate money in the economy. It's to provide some kind of essential services to those children. But you still find some people, okay, we have a couple of kids, because we are not working. If we register 4 of them or 5, I don't know, the maximum is maybe 5 or 4 per family, I don't know. It's some kind of income. It is put together, but it is not necessarily channeled through to the children. It is a real thing. So there is no harm in us really debating and try to inform ourselves. If there are new ways, if somebody comes up with innovative ideas as to how best we can assist these people from abusive families, it's not easy to police, that we go and police everybody. It's not so easy. But the reality is there. We have a problem, and you have seen images in TV, in our NBCs. People go there and show the horrible condition under which a person lives. You have seen these images, colleagues. But ask whether this person receives pension. It's registered. This person receives pension. But look at the condition under which this person lives. So that pension money, if it is saved in the manner that's supposed to, it could buy blankets for this person. It could buy a little bit of something for a person. But that's not what is happening. So our communities need definitely to be educated as it's proposed. That we should educate our people, because really, it is not just government. That government has there's a limit to which extent the government can go. You see? But we cannot now extend and police every household. It's impossible, but maybe with some efforts. You know, when you see images on social media or on NBC, you wonder what happens. Where are our councillors? Where are everybody who is there in the structure? to be able to identify and report this person. But no, we see these images from social media, from TVs, from newspapers, etc. But the picture that's presented is that this is a careless government. But in the first place, government, there is a pension provided for to this person, but there are people there who are supposed to tell, to stop it, because there are structures from the headman, from the chief, from the pastor, a priest, from a nurse, everybody's there. But neighbors, everybody's there, but the system is just not caring. But we tend to be more condemning the other people, to be more negative, but we are not looking at the positive aspect that is happening. This person, most of whom that are exposed, are people who are receiving social grants, be it young people or very old people. So let's just discuss it and see what can be done out of it, so that, but people must also see out there, that when we approve this money here, we mean it and we want people to benefit, not to go and spend money on and confiscate people's cards and all these things, perpetually putting people in poverty and accelerating their death, because this person is perpetually worried about this death. So these are real things, and I'm sympathetic to this proposal. Thank you.
I recognize Honorable Minister Utumbu, Lucia Utumbu.
Thank you very much, Deputy Speaker. Firstly, let me thank the mover of the motion. The mover of the motion, yes. I'm looking at you, Madam, the mover of the motion. First and foremost, let me appreciate you for moving this motion that is of critical importance, especially that it talks to the social welfare of especially the elderly. And I want to look at it from a different perspective. The Honorable Deputy Minister, being a social worker by profession, I would rather look at this as a psychosocial problem that is multifaceted. I am saying so because as much as the motion is focusing on the elderly abuse of the elderly's pensions, there are other grants, like they were being referred to by Honorable Kapofi. The OVC grants, there is a pension that is received on behalf of the children of the deceased from the GIPF and other funds, the old mutuals and so on. There is also grants that is received by the disabled. There is grants that is received by many other categories. But in all aspects and in all these categories, there is abuse. And that's why I am looking at it as rather a psychosocial problem that talks to us as a nation. Are we a caring nation? Because government cannot regulate us at the household level. And now when we bring these challenges at the doorstep of government, we are exonerating ourselves as members of the communities on our duty responsibility of ensuring that our people are taken good care of, and like it was being said, a neighbor take care of the neighbor, a child take care of the parent. If we look and we take an example of especially a young mother or a young parent who would leave the 3 grandchildren with the grandmother. Of course, I heard somebody talking about unemployment being the contributing factors. Yes, in some instances, but not in all instances. In some instances, these persons leave these children because their aim is that they are going to look for employment and be able to send money and support their children while they are being taken care of by the grandparents. And at the end of the day, in many cases, it doesn't happen. They come here, the beer that Honorable Venani was referring to here becomes the best commodity that they can utilize their money on, and they forget about the children. And then the system expects those elderly and those that are receiving whatever type of grants to be the ones to take care of those problems. We have the disabled here, even here in Windhoek, we have people who are paraded. Every day they are dropped at the street corners to beg for some income, and they are receiving some social grants that are being used up by other people elsewhere. And all this, when I look at it, it's the moral fiber of us as a community and the duty of care. How much of what we do to ensure that at least we take care of the next person. Government or institutions that are in place can never do this on behalf of the communities. But rather, maybe from the social perspective, and like I'm saying, the mover being a social worker and from that background, would rather expect to make some recommendations that have got to do with starting talking to our people at that level for a change of heart and change of mind. Because where we are now is that we expect everything for government to have a solution. And we as community members or as individuals who benefit from these systems, we must just be left alone to do what we wish and what we feel is okay. And again, when we want to link this to poverty, the poverty mapping reports and the poverty index reports do not necessarily prove that the elderly that are being abused are the ones that are poor. Yes, because I think I have picked up some kind of sentiments that are moving towards that effect. But the poverty levels of our people are defined in many categories and are caused by many factors. And it does not necessarily mean that those that are deprived of some benefits or whose benefits is abused are the ones that are poor. Poverty is there, we agree, and we must also then confirm that to a certain extent these social safety net programs have brought about the reduction in the levels of poverty. Yes, whether we like it or not, $60 that was being received at independence, comparing it with 1,300 that is currently being received, there has been a tremendous improvement because at independence we had 70% poverty levels. And now when we talk of 15% of those that live in extreme poverty, there is a difference. Somehow these two cannot correlate and they do not have effect on each other. What we need to pay more attention to going forward is to ensure that our moral fiber as a nation and our moral compass is at a place where it's supposed to be. So that the duty of care should be starting at the household level. Like we're saying, it will never be practical for us to police from household to household. But who cares? We have become this nation of, if they are abusing this money in their house, it's their problem. I could be a neighbor that knows of a social worker that have access to an institution that can assist this family, but I will turn a blind eye and pretend as if I don't see this. And tomorrow I would go and advocate for those that I feel that are deprived and they are not benefiting from the system. I think all of us from various fronts, maybe at political party level, maybe at whatever level, we all need this duty of care and amplify the responsibility of ensuring the welfare of our people.
Honorable Minister, there's a point of order.
Yes, Honorable Minister, it's quite correct that people, there should be a measure of individual responsibility in everything that we do in life. But amongst the things, and asking this question because I heard the Honorable Kapofi express the same sentiments as you are, and to a certain extent the Honorable Kala as well, Sletvine. Now, that leads me to ask this question. Amongst the examples of abuse and exploitation that is as explained by the mover of the motion is the fact that on payday there's a commotion of activity happening around the pay point. People flocking to this, flocking to the pay points to sell things, at times at exorbitant prices. Now, I'm not necessarily saying that that is a bad thing, because it could also mean bringing services closer to those people or goods closer to the elder. But for instance, or for interest's sake, say that there is exploitation happening at that level. On payday, goods are taken to the pay points, including alcohol. People consume, people take goods at exorbitant prices, and therefore this money does not have the optimal benefit to the recipient as it is intended. In that event, would it then not be for us to address that at policy level as opposed to individual level? The reason why I'm asking that is this, or jointly, individual and at policy or governance level. The reason why I'm asking that is this. Yes, indeed, there are problems that can be solved by the community, by the household. But similarly, your argument seems to deny that government has done, it seems to suggest that government has done enough, therefore nothing more can be done from the legislative or governance or policy framework. Yes. So I tend not to agree with that. So the question is then, at that level, or such problem as that was explained, is it then not for us then to deal with that at policy level? Like we say, schools, you cannot have a Shabin X kilometers or X distance from a school. On election day, you cannot sell alcohol. You know, these sort of things. Is that not interventions that we can have to prevent abuse at that level?
Thank you very much, Honorable Mwarukwa. Before you derail me, I want to concentrate on the motion. From the policy perspective, there are many policies that are speaking to informal traders, that are speaking to the regulated hours, places, and times of the sales of alcohol, especially if we are to talk about alcohol. But we must remember that Namibia is also a free market economy, where you cannot limit the SMEs or whoever is the trader from getting to a point where they believe they would make an income. If it's regulating them in a manner of ensuring that there is order and not chaos, I believe not so long ago there was a decision taken to move the pay points out of the school and church premises where it used to take place in the past. And that decision was taken in response to what you are querying, because it was interfering with the education system. And now again on the other side, we are crying for better infrastructures where we should operate from. I think every time when we take this decision, there will always be other independent effects that would come in that would have a negative impact. And at the end of the day, we must balance. As much as there should be an intervention from the policy perspective, there should also be a duty of care from us. It should not always be policy and government that will solve all our problems. And that's why I'm saying, where is the social part of us as members of the community? The two should meet And they should converge for us to be able to keep our nation on the balance. Because otherwise, if we expect the government to solve all the problem, and we from ourselves as now, the children and the parents and the caretakers exonerate all the responsibility away from us, we will not get anywhere. And maybe the last point to talk to is just to say, going forward, I would expect now, especially from Honorable Muharuka, who made the last intervention, to propose the better way forward. My proposal to the mover of the motion was to say that widen the scope. It should not only be limited to the elderly, because abuse is not only the category of social welfare pension recipients, but in all other categories of all other grants recipients. And it will let us approach it from the social cycle perspective. And I believe when all of us converge and try to find a solution from both, either from the policy perspective and from all other social institutions that we have, I think at the end of the day we will be able to work out a solution. Thank you very much.
I recognize Honorable Isete.
Yes, Honorable Deputy Speaker, Honorable Members, in short, my contribution towards this motion, I propose that we come up with stiffer sentences to anyone that will be found guilty in abusing pensioners' resources or money or funds. These are all of us money. It's taxpayers' money. It's meant to help our pensioners. It's meant to help our elders, and not to be abused. We, as lawmakers, as leaders, we perhaps need to engage business people. If these things are happening at business level, when they are going to buy, maybe they are overcharged and so on, or when these business people are following pensioners or pensioners' points and they are overcharging pensioners, we need to speak to them. And if, for example, Honorable Venani, I don't know why I keep on saying comrade. Yeah, Honorable Venani, if you are aware and you know a certain shop where people are abusing pensioners, report them to the police. Right. Don't wait until coming to the floor of Parliament and air these things. Otherwise, you will be equally guilty. Absolutely. If you know something is wrong, immediately report it to the Namibian police. Yes, in order to help our people. Thank you very much.
I recognize Honorable Kabekotora.
Yeah, thank you very much, Honorable Deputy Speaker, for giving me the floor. I want to thank the mover of the motion. It is indeed a very important motion. We can try to put it under the table, but it won't help us. The first thing that one has to do when you are faced with a situation is acknowledgement. And we need to acknowledge the fact that there was a good reason why we gave money to our to our pensioners. And we thank the government for increasing the amount of money to a point where we have now 1,300. But we must also acknowledge the fact that does this money end up for the intended purpose? And I think it is not. In some cases, I have seen vehicles that are having a habit of knowing exactly when the pay will come for the pensioner, and they will follow not the fixed one, but they will follow those remote vehicles that are traveling from one point to the other. They will listen to the radio, and then if the pay point will be at Chimochamo Kwandindi, no Chahorovara, no, they will follow that every day. And they will go with items to sell there. And that is also a form of abuse. It's not only alcohol, it's also the fact that these people are being bombarded with items that they have to buy there on the spot. That's one. Two, I think it is a fact that financial intelligence is not something that we are being taught in school. And you can just imagine if members of parliament have difficulty managing their funds, how more difficult will it be for my mother to manage the 1,300? It's going to be even more difficult. And I want to say this, make this statement, to say that the abuse, in my view, is not only alcohol, it needs to be broadened because it's abused in different ways. It is a fact, Honorable Deputy Speaker, that when you listen to Honorable Kale Sletwine talking about lies that Honorable Kawandenge is making, you come to understand a fundamental difference between Kawandenge and Sletwine. There's a fundamental difference. And I want to demonstrate this by an example. When I was the official of the Bantu Sake Commissaries in Opuo, way back then before Mutoro them were born, I had to mediate between the white Bantu Sake Commissaries and a worker of his. And the whole problem was the gentleman came to the boss and said, Meneer, I want to go, give me leave, I want to go and bury my mother. My mother passed on. Then Mr. Van Sale said, yes, by all means, please go. So off he went. And he came back after a week. After 1 month, he came back again. And I was now translating again. Meneer, I need leave. I want to go bury my mother. And then Van Sale said, you're now taking me as a fool. How can you have two mothers? And the guy was saying, are you now insulting me while I have a death in my family? I'm telling you that my mother died. And that was almost a fight. Why? Because these two people there was no congruency between what they were saying. Because the one was thinking from a nucleus family, like Kale Sletwine, and Kawandenge was talking from an extended family perspective. That's why people are calling each other liars and things like that. It's because you don't understand each other. It's true. It's true. Yeah, well, that's your problem. The point that I'm trying to make is that my mother, when we sleep in a hut, 7 of us. And my mother will not even eat before all of us have eaten. That is the black people's culture and mentality. That is how we grew up. Kale, your firstborn, I'm sure he had his room on his own at the age of 10 weeks. At the age of 10 weeks, a room on his own. We live communal, you live nuclear. That's a major difference. And until you come and understand that, You will call Kawandenge a liar when Kawandenge is talking about the truth. So,
yeah, point of order.
Honourable Deputy Speaker, you see, that is how we create problems. And I want to correct it. I never said Honourable Kawandenge is a liar.
You said all black.
I never said that. So I don't know where you got it from. I said what he said is that his grandmother or the elderly people will never tell the truth if they are asking questions. So I never said he's a liar.
Grandparents will never tell the truth.
So you must be accurate with your statement. Secondly, I somehow despise it if people stand up here and assume things that are not true.
they are liars.
And to put it right, I never had my own room, never in my whole life. And I left my home to a hostel when I was 6 years old, where we were 12 in a room.
That's beside the point.
So no, it's not besides the point.
It's beside the point.
Because he wants to portray me as an elite that does not understand the African policy. I take exception to it. Thank you.
Can I come in?
I thought you would stand up and try to withdraw what you said. And now you're trying to defend what you said. You're supposed to withdraw what you said. Honorable Deputy Speaker, I still believe that government has got a role to play in trying to address this matter. It cannot just be something that will be pushed to society and what have you. Because first and foremost, when one initiates an intervention, there is something called planning and impact analysis. What is the impact of a thing that I've done to an individual? Let me give you another example. The Ovacha people in Kunene region used to have a specific lifestyle. And the lifestyle of those people was to collect fruits from the field, to move from one point to the other, and to hunt. That was the basic lifestyle of those people. The government came in and said, we're going to provide you with goats so that you can move away from your lifestyle. What are the requirements of a goat? You must not look at, you must keep an eye on those goats on a daily basis. And the goats don't give birth on a daily basis. So the end result was that as much as your intervention was meant to be good for these people, it ended up depriving them from a livelihood, and eventually they have to let go of these goats because they felt as if they have been captured. And they don't have food on the table because now they have to stay in one place under a roof, corrugated iron, and what have you. So the point that I'm trying to make is that when we do some of these things, and motions like this are coming up, we also need to interrogate what we have not anticipated when this whole thing was initiated. And when we realize that there are certain interventions that need to be made, we make those interventions. Because I'm wary about the government always trying to push things onto the community. Education, community. Everything, community. And even financial, we meet the government halfway, forgetting that the money that the government is using is actually taxpayers' money. The government doesn't have money. They don't create money. They don't earn money. It is taxpayers' money. But every time people say, meet the government halfway. The money was given for the social goods, things that could not be done on an individual basis, like education, housing, roads, and things like that. Now, all of a sudden, you find a minister saying, let's meet halfway. Halfway from what? I pay 38% tax, and at the end of the day, you say, let's still meet halfway. What, you want me to come in 100% paying tax, and then at the end of the day, doing what? So the government must also, through this, learn from that maybe there is something that they have not considered, and that is why the motion is being brought to table. The Honorable Winyangwe, I support your motion.
Thank you. I recognize Honorable Emma, your fellows. You have the floor.
Thank you so much, Deputy Speaker. I would also like to add my voice to the debate on the floor. And it's quite interesting that some speakers are taking the floor but not actually giving solutions. And I think that's something the mover of the motion wanted. We see a problem. The debate, some actually saying perhaps policy should address the challenges. Some feel it is not because community should come in to assist, while others don't actually give any solutions at all. But I think this is why this legislative house is created, for us to then deliberate on issues that will have and add value. So there are many moving discussions happening, but the motion is quite linear. It wants solutions. But I will try to add my voice to all of them, because really most of what I wanted to talk about was already taken by Honorable Lucia Ipumbu, but I still want to add my voice to some of the things that are cropping up as speakers contribute. I want to make the statement that black people are not a homogeneous group in society anyway. Black people have different lived experiences. That's why we have diversity in black communities, because we're not a homogeneous group. Yes, we have a lot of similarities. Yes, we have a lot of past. So this talk back and forth to make it as one big group that subscribes to the same principles and same values is not accurate and it's not true. And any other underlying intentions of trying to paint the picture that black people are a homogeneous group, I would like to reject. Then secondly, Deputy Speaker, it's something the Deputy Minister of Youth was saying as the contributions were being made, that we cannot legislate morality. And it's something that I agree with as Honorable Lucia Ipumbu was making her contribution, because where do you draw the line between the state stepping in to legislate morality? Abuse is something that somebody chooses to do, regardless of their upbringing, regardless of the exposure they've had. It's a choice they make. Of course, we can, after the act of abuse, there can be interventions. The police can capture the person, try to resolve it at that level. That's why there's a department in safety and security around community policing, because the arm of the law cannot extend to every area in a harsh and straightforward manner. There are many gray areas when dealing with people.
Sometimes
but then sorry?
I'm just saying, abuse can also, when you look at it, could also be interpreted as criminal act.
Exactly, and then that's where the law is hard hit, black and white. But there are some gray areas in which you know that it can be resolved by using community means. And I think this is the sentiment I would agree with, that abuse of this nature, where vulnerable groups in society are being abused by their most closest family members, should be a concern of social decay. And that's where really we say law cannot, nothing can end with, not everything can start and end with law. And that is why with the solutions proposed around education, maybe even financial literacy for the elderly, and strengthening our structures and systems in societies, our community, our sense of community, and ensuring that every person who considers themselves a leader in a community should take responsibility for the most vulnerable, not only the state. And that is why you find abuses, regardless of not only as old age abuses, whether it's the abuse of the people living with disabilities, abuse of children who are vulnerable, abuse of scores and cores of society.
Point of order.
Honorable Deputy Minister, just a teeny whiny question. While I might agree with you that we might not necessarily be blacks homogeneous, as you were saying, but will you agree with me with the sentiments that I made to say, while we might not necessarily be all the same, there are certain characteristics within us as black people that makes us the same, in as far as, for instance, raising our kids, the treatment of our parents, irrespective of whether they are biological or not, are there not some of those that makes us homogeneous? Just a question.
The exception to the rule is not the rule. So even if we have similarities, that still does not make us a homogeneous group. And that's why I think it's a character of humanity. Cultures and social norms continuously grow, they change, and that's why it brings me to my point that we have a social decay. Yes, you would also agree that before it would have probably been unheard of for children to shout back at their parents or beat them physically or do anything like that, but we're seeing it more and more because society is changing. There is some social decay happening in society where some values are not as respected as others. So to say that there is exceptions, yes, there is exceptions to the rule, but that does not make it the rule, and therefore we're not a homogeneous group as black people. So leading to my next contribution in that, I think there is that sense of negligence, that we are neglecting our most vulnerable members of society, and that should then be the question back to us. Regardless of level of leadership, whether it's parliamentarians, a teacher in the community, a pastor, a community leader, all of us have some sense of responsibility. So this notion that, you know, people must not meet government halfway, I think I want to challenge. Because even as when we live in societies, in homes, as a parent, you could give your child the world, but they could easily, you know, digress from what you have instilled in them, because unfortunately human beings have their own choices, and there is no amount of legislation or policy that you can do to actually prevent some of these abuses. And that is why when abuse happens, it unfortunately already happened. What we need to do is to strengthen the resolves in our communities to ensure that there is swift action. Government and policy only jumps in after the act. But you don't want the act happening 10 times before government or state actors jump in. That is why the responsibility at community level is important. Then those sentiments about that items, you know, there are these people going around following the pensioners to buy their items as soon as they get their grants. I think that the argument can be twofold. I mean, in my experience, would know my grandmother would rather there and then buy the necessities of the house and make one trip home, as opposed to get her payout and then go to the shops that maybe she will still have to take the transportation cost to go to the shops or to the nearest town or settlement or wherever to actually get the goods and then go back home. So I think it's relative. But at the end of the day, quite honestly, how do you police something like that? It becomes difficult, and that's why you have interventions at community level that should take responsibility. And this is where I want to caution. If we leave everything to the state to do, I think we are immobilizing ourselves as citizens of the country. And this, the immediate thought that came to mind was, where do you give people the choice to make their own decisions? People must have the liberty to make the choice and hopefully choose right. The state mustn't constantly encroach on people and try to box them to make the right choice, because one day it's not going to work. One day it's going to be redundant and people will abuse the opportunities they get. It's like trying to hoard a child in a home. The day that child gets out, they want to experience everything at the same time because they don't know when they'll get that opportunity again. And the first theory that came to mind is the Irrationality Theory, where you actually try to take the responsibility away from the person and give it to another person. That makes that person feel like they actually, you know, cannot make decisions, and therefore their decisions cannot have value. And that would mean that, for example, when you and you can see it growing in society, you'll find a town that is dirty, or somebody walking next to dirt on the ground, rubbish on the ground, and will say, I won't pick it up because that's the role of the town or the role of the city to do so. That already demonstrates, that simple example demonstrates that when sometimes you export responsibility and duties to state actors, the person, the citizen, sometimes absolves themselves from actually taking any action. So I think that is why it's important that we strengthen the resolves at community level and not export the responsibility to the state. So when the sentiments are being made that people should meet government halfway, regardless of government having the responsibility and ultimate mandate, we cannot divorce citizenry responsibility from social issues, because human beings can only regulate human beings. And as people that grow up in social settings, only then can you have the most effective effect. So with those words, Deputy Speaker, I would like to end my intervention here. Thank you.
Yeah, I recognize Honorable Maureen.
Thank you, Honorable Deputy Speaker.
Yeah?
Would I be allowed to postpone the debate to Tuesday?
To postpone?
Yes.
Till when?
Tuesday.
Or till
No,
Wednesday?
tomorrow's question.
Yeah, it's okay. Which date you want?
Tuesday.
Okay. But there is somebody who postponed the... Yeah, it's okay. You can do it. But Honorable Minister Doreen Sioka postponed it till tomorrow. It's okay. We'll see how far we can go. With this, the House is adjourned till tomorrow, 14:30.